Welcome dear students, I am Dr. Pratyusha and in this video let us learn about some miscellaneous topics in nose such as foreign body, rhinolith and maggots in the nose. Okay, first let's begin with foreign body in the nose. Now as an ENT doctor, foreign bodies are very common in our practice, either in the nose or in the ear, or sometimes even patients swallow foreign bodies and it's impacted either in the trachea or esophagus. Okay, so foreign bodies are all in all important to us, and please remember that usually pediatric age group are the patients that we see with foreign body cases, because they are the ones who usually put something into the nose or ear like that. Alright, so what are the substances that are usually put? Some small seeds or pieces of paper or chalk pieces or something like swabs of cotton sometimes, like that, anything, usually these playful toys and all which are very small in size, they tend to put it inside the nose and that gets impacted there. So the most important things that you have to remember are, first, your patient is in the pediatric age group, it's a child. Second, all the various objects that I told you, you should have a brief idea about them. Now, how does the patient present to you is important. If it is a very small child, sometimes they would not even tell parents about it. And see, sometimes when there are two children, it's possible that the older child has put something into the nose of the second child, the younger one. And the second child cannot communicate and the first child also does not tell anything to the parent. So these cases go unnoticed. Or sometimes the parent comes to you with a history. Either the parent has seen the child doing it, or the child has themselves repeat, or the child has told the parent about such an incident. So one possibility is the parent will give you a history of foreign body into the nose, being placed in the nose. Or second possibility is it has gone unnoticed and later on the patient presents with unilateral foul smelling nasal discharge. Unilateral foul smelling nasal discharge a few days later or a few weeks later. Now the dictum is, if you find a case of unilateral foul smelling nasal discharge and if it is a child, first think about foreign body. Only then you can think about anything else. Okay? And after ruling out everything, in case it is not a foreign body, what are the other possibilities? It could be a case of unilateral rhinosinusitis, or it could be a case of maggots in the nose, or sometimes a rhinolith is possible. All these are other possibilities, but usually it is always a foreign body. So thoroughly search for a foreign body. Okay. So what should we do further? The treatment is very simple. It is removal. Removal of foreign body is the solution. If it is a rounded object, sometimes they put, as I told you, these seeds or peanuts into the nose. Now you might wonder how it stays in the nose, but it actually stays. Children tend to push them inside. It's not like they take and put it inside the nose. They tend to push it inside and somewhere it gets lodged. And they actually stay there for a long period of time on the floor of the nose. So if it's a rounded object, you can pull it out with a forceps or a hook. And otherwise also we can insert forceps and remove, even if there are some sharp objects or anything. Investigations are usually not required. Your own clinical examination will suffice. If it is a radio opaque object, then it can be detected on a radiological investigation. Now sometimes, this is important, it is lodged very much deeply into the nose. It's almost towards the edge of the nose. Then the better idea would be to push it further into the nasopharynx and collect it from downwards. Okay, that is done if it is very deeply lodged into the nose. So these are all various techniques you will understand when you are actually doing cases like that, when you are treating such patients. But I'm broadly giving you a theoretical idea as to how you should react when you see a patient like that. So this is how you remove the foreign body. Now what are the complications in case it is left like that if it is unattended? It can lead to infections. It is the infection that is leading to your foul smelling discharge, and it can lead to rhinolith formation. All these are various possibilities. And it can also press upon various surrounding structures and lead to nasal obstruction if it is huge and big. So this is about foreign body in the nose, and if at all the patient is not cooperative while removing, you can also anesthetize the patient. If it's a very small child around 1 to 2 years, that is the age group when they usually don't cooperate with doctors. They don't cooperate for a normal nasal examination also. So removing foreign body can be a little difficult. In case in your manipulation of the child suddenly tilts, it can go elsewhere and lead to problems. So in such cases, you can happily anesthetize the patient and put the patient in rose position. That is most convenient to manipulate and remove stuff. Okay. So this is about foreign body nose. I hope it's clear. Let's move on to the next topic, and that is rhinolith. It is in fact, I can say, a continuation of foreign body in the nose. What is it? Rhinolith. So what exactly is rhinolith? Rhinolith is a stone in the nasal cavity. Stone in the nasal cavity. Stone means, is it some foreign body stone that is put into the nose? No. If at all a stone was put into the nose, a small stone, we will still call it foreign body in the nose. We will not call it rhinolith. Rhinolith means a stone that is formed inside the nose. It's not some external stone that has been put into the nose. It is a stone which is formed in the nasal cavity. How is a stone formed in the nasal cavity? On the nucleus of some foreign body that has been left unnoticed. I told you in the complications of foreign body, rhinolith can occur. So on the nucleus of some exogenous foreign material, it could be any of these foreign body, like I told you, chalk piece or slate piece or seeds or grains or something that is very small, or some clot of blood. A blood clot can also act as a nidus. Around that, what happens is, on this nucleus, various substances start depositing. Calcium and magnesium salts are most important among them. On an exogenous nucleus, various depositions occur. What are most important among them? Calcium and magnesium salts. And finally, a stone-like structure is formed, that is rhinolith. Now what you have to remember is, foreign bodies are common in children, but rhinolith is seen in adults. Your patients are usually adults. Okay. So a stone is formed, and how does the patient present to you? The patient does not know that there was a foreign body inside the nose left behind. So the patient will present to you with unilateral foul smelling discharge and also unilateral nasal obstruction. Why obstruction? Because the rhinolith is occluding the nasal cavity. And why discharge? Because this can act as a site of infection. It can act as a nidus for infection to occur. That will lead to foul smelling discharge. And now the problem with the stone is, it can press upon the neighboring structures. It will either press upon the septum or it will press upon the lateral wall of the nose. This pressure effect can actually lead to pressure necrosis also. Pressure necrosis can occur either on the septum or on the lateral wall of the nose. Because of the pressure effect, what clinical features can be seen? Again, there could be epistaxis, bleeding from the nose. There could be ulcer formation. And if it is pressing upon any nerve, neuralgias can occur. So the patient can present to you with any of these clinical features. So these are the effects of a rhinolith. Now a rhinolith is a brittle structure, okay. Sometimes small pieces of the rhinolith of the stone will break out and they come out, okay. It's very brittle. Even while examinations, small pieces can break out of the stone and they can come out. That's the nature. When you examine, you will find a grayish or a greenish mass that's very irregular, hard and brittle. That's how a rhinolith looks like. So what should you do? The treatment again is removal of the stone. But now, because this is an adult patient and a rhinolith is a more organized structure, so we have to anesthetize the patient definitely and then remove it. If it's a large one, break it into small pieces and then remove it. If it's a small stone, it can be removed in one go. Sometimes bleeding can occur while removal, but that can be controlled and it has to be removed. A rhinolith has to be removed. So this is about the next condition, rhinolith. I hope you have understood. It's an adult patient and it's much more serious than a stone, a foreign body. Okay, foreign body can complicate into rhinolith. What are the complications of foreign body? One, it can organize itself into a rhinolith. It can result in infections. Infections can occur in rhinolith also. And another very bad possibility is that can be inhaled further into the tracheobronchial tree. A foreign body, not a stone, rhinolith cannot be inhaled. A foreign body can be inhaled into the tracheobronchial tree. Okay. So this is about a foreign body and rhinolith. Let us look into the next structure, and that is maggots in the nose. Let us learn about maggots in the nose, which is called as nasal myiasis. This is nothing but maggots in nose. So what are maggots? They are actually larvae of flies. Flies usually belonging to the genus Chrysomia. The larvae of these flies, I'll tell you what exactly happens, the entire story. In a patient who is having foul smelling discharge because of say atrophic rhinitis, or it's a syphilitic patient or a leprosy patient, or for any reason if there is foul smelling discharge for a prolonged period of time, these flies get attracted to that foul smell. So they go into the nose and the maggot lays eggs. Around 200 eggs it will lay in a single go. And within 24 hours, these eggs hatch into larvae. It is the larvae that are very destructive. Now you think the small creatures, what they can do? No, they cause extensive destruction. They erode into bones. They spread into the nasal cavity, sinuses, nasopharynx. They can go all around and they can destroy bones. They can cause erosion in all surrounding structures. And I'll tell you the clinical features. So these larvae are the ones that are causing maximum destruction. And the patient is not aware of this. What is the clinical presentation? Let me tell you. What are the clinical features? Initially, the patient doesn't know that he is infested with this. First, immediately as these hatch, the patient will experience intense irritation. There will be intense irritation. Now imagine so many larvae, all of them are crawling like that inside the nose. It will cause intense irritation to the patient, and apart from irritation there will be sneezing and there will be lacrimation and even blood oozes out actually. It's not that gush of thick blood, but thin secretions keep coming out, oozing of blood. All this will be seen in the first 2 to 3 days. And then from 4th day onwards, slowly what will happen, the maggots will start coming out. And then the patient realizes that, okay, some living structure has gone inside and these are coming out. And that is the time they usually present to the doctor, to the hospital. And you can also see the maggots and all the larvae inside. The nose is almost filled with these maggots. And there will be a very bad foul smell around the patient. The smell of maggots is very intense. I mean, when the patient is walking, actually all around in the OPD, there will be that intense smell, foul smell around the patient because of the maggots. And as I told you, they invade into all surrounding structures also. They go into nasal sinuses, paranasal sinuses, nasopharynx and everywhere. So once you identify, what we have to do is we should try to remove as many maggots as possible manually. But once you put light and try to examine, they will try to hide. They will start panicking, they will run all around and they will hide into dark places. They will go into whatever crevices that are available. But whatever we find, we have to remove all of them and then instill chloroform or oil and try to kill the maggots. And then with a warm saline nasal douche, all the killed maggots, all the slough, all the crust, everything will start coming out. That is the standard treatment protocol for this condition. But most important is you have to teach the patient about nasal hygiene, because there are already these foul smelling nasal discharge cases on which maggots infest. So the patient should keep the nose clean so that the fly itself does not infest there and lay eggs. So nasal hygiene has to be taught to the patient, and during this process the patient has to be covered on a mosquito net so that again flies don't come and this life cycle does not continue. Okay, so that's about nasal myiasis. I'll tell you, this might sound very simple or a little unimaginable, but it's actually a very, very dangerous condition. If not attended, this can actually kill the patient, because maggots will infest deep inside into the brain also, and they will cause meningitis. They will cause meningitis, and finally they will lead to death of the patient if not attended. So it's actually a very serious condition. If you find a patient of maggots, we have to immediately clean them, kill all the maggots, and you have to sometimes, by the time the patient presents to you itself, all necrosis of bones and everything has occurred. So you have to clean all the slough and treat accordingly. This is about maggots. So these are some of the miscellaneous conditions that are encountered in the OPD when you sit. Foreign bodies, rhinolith and maggots. I hope you've got a clear understanding of them. Thank you very much.